learners, hope you're all well. So today we are going to look at a cardiac bed for dyspneic patients or patients who are having difficulty in breathing. It will be a continuation of an unoccupied bed or an empty bed. So before we go further making this bed, we need to look at the equipment or requirements for this kind of bed. And on our top shelf, we shall need a bell for communication, an airing to relieve pressure of the buttocks of the mattress and its cover. Then we shall need a pillowcase. On the bottom shelf, we shall need 4 different pillows of this size, and then we shall need a small pillow to support the bony premises. At the bedside, we shall need a footrest to support the patient's foot from dropping. We shall need bed elevators to elevate the bed in case there is need. We shall need an oxygen cylinder because there is need to connect oxygen to the patient. We shall need a screen for privacy. We shall need extra linen for making the bed, where we have a long Macintosh, a bottom sheet, a draw Macintosh, a draw sheet, a top sheet, a blanket, and then a counterpane. Then we shall need a bed cradle to lift off the weight of the linen from the patient. We shall need a tray for emergency drugs, a tray for vital observation, a hand washing facility, a sputum mark, and then a pen and a pencil. Lastly but not the least, we shall need a cardiac table and a backrest, which is on our bed already. We shall show you as we are continuing with the procedure. This is a 2 nurses procedure as usual. So I'll call Sister Frida to be my assistant. You're most welcome. So as the rule goes, we should always make sure we wash our hands. And this time around, we are using an alcohol hand rub. Together with my assistant, we scrub our hands. So after that, we pull the bed away from the center, but make sure you stand in the middle of the bed. In case the bed fails, you lower them. So we have to check for the firmness of the bed. Check your springs. And you verify it. So after that, you turn the mattress. And straighten the mattress cover. So we have to make the bed as an unoccupied bed, and so we start with the long Macintosh, spread it on the bed. We get our draw linen, our bottom linen, spread it on the Macintosh. We tuck in the top and meter the corner. Do the same on the bottom of the bed. Tuck in and meter the corner. After that, you tuck in the whole mattress. This is to help the bed look neat. So after that, we go to the draw Macintosh and spread it evenly. Get our draw linen or sheet. We do the same. Make sure it covers the Macintosh to prevent irritation. So after that, we have to look for our backrest, and as we said earlier, it is on our bed. So we lift the head of the bed and so this is the backrest. we've lifted up. So after that, we have to use our pillows. Put it in a pillow cover or a pillowcase. You dress the pillow well. So as the rule goes, we shouldn't let the open side face the doorway. We do the same to the other 4 pillows. You make sure your pillows are not falling off the bed. So this time around, the patient can sit here comfortably and lean against the pillows. Then we use our earring, and in its cover, we place it where we expect the patient buttocks to lay. So after that, in case we had a patient in our bed, we would use a bed cradle. But just because we're not expecting a patient right now, so we won't use the bed cradle. However, we shall use the cardiac table. So you can first remove the chairs. And put our cardiac table. So on top of the cardiac table, we can put our sputum map in case a patient feels like coughing or sputum. Then the bell for communication, a pen and a paper in case a patient feels like writing anything. Or when you're providing a meal, you can put it on the cardiac table. When we have a patient in bed, this patient is going to rest the foot on a footrest to prevent the foot from falling down or having a foot drop. So after that, we can pull the bed back to the wall. We clear away all the other unnecessary requirements and then wash our hands after the procedure. Thank you so much for listening.